Welcome to this course on hospital ecological and reproduction. In this first module, we will focus on hospital ecology, understanding how the hospital environment functions as an ecosystem, how humans interact with it, and how it affects health outcomes. Hospitals are not just buildings for treating illness. They are complex ecosystems that bring together patients, healthcare workers, microorganisms, equipment, and the physical environment. Just like natural ecosystems, the hospital environment has interdependent relationships, and any imbalance can influence human health, recovery, and disease transmission. Section 1. Understanding hospital ecology. Hospital ecology refers to the study of the interactions between patients, staff, microorganisms, and the physical hospital environment. It recognizes that the hospital is a living system where microorganisms such as bacteria, viruses, and fungi coexist with humans. The environment, air, water, surfaces, equipment, affects infection rates. Human activity, including medical procedures and hygiene practices, shapes outcomes. Thus, the ecological balance in a hospital is central to patient safety. Section 2. Components of the hospital ecosystem. The hospital ecosystem has several interacting components. Patients, they are the primary users, often with weakened immunity, making them vulnerable to infections. Healthcare workers, doctors, nurses, cleaners, and technicians act as caregivers but may also become vectors of infection if hygiene lapses occur. Microorganisms, both beneficial and harmful microbes, are present. Some are harmless, while others, like antibiotic-resistant bacteria, are dangerous. Physical environment, air quality, water supply, sanitation, waste management, and equipment design all influence ecological balance. Technology and equipment, life support machines, surgical instruments, and diagnostic tools require strict sterilization to prevent contamination. All these elements interact continuously, making hospitals unique ecosystems. Section 3. Hospital ecology and infection control. One of the most critical aspects of hospital ecology is infection control. Hospital-acquired infections, or nosocomial infections, arise when ecological balance is disrupted. Examples include bloodstream infections, pneumonia, urinary tract infections, and surgical site infections. Factors that contribute to infections include overcrowding of wards, poor hand hygiene practices, contaminated air conditioning or water systems, antibiotic overuse leading to resistant strains like MRSA. Thus, ecological management in hospitals focuses on cleaning protocols, sterilization, air and water monitoring, antibiotic stewardship, and waste management. Section 4. Environmental health in hospitals. Hospitals consume large amounts of energy, water, and chemicals. Their ecological footprint can affect not only patients but also surrounding communities. Examples include improper disposal of medical waste leading to soil and water contamination, airborne pollutants from incinerators, noise pollution affecting patients' recovery. Therefore, sustainable ecological practices, such as green building designs, renewable energy use, safe waste management, and reduced chemical exposure, are now essential for hospitals worldwide. Section 5. Human health and ecological balance in hospitals. The hospital environment directly affects healing and reproduction of health. Clean air, natural light, and controlled noise improve recovery rates. On the other hand, poor ventilation, overcrowding, and contaminated surfaces prolong hospital stays and increase complications. Thus, hospital ecology is not just about preventing infections, it is also about creating an environment that supports healing, reproduction of wellness, and long-term sustainability. In this first module, we introduced hospital ecology as a system of interactions among patients, staff, microorganisms, equipment, and the environment. We explored infection control, environmental health, and the role of ecological balance in patient recovery. This foundation leads us into the second module, where we will shift focus from ecology to reproduction, examining how reproductive health is managed within hospital systems and its link with ecological principles.